Thunder Bay is seeing COVID-19 numbers that are trending in the wrong direction. Looking at a graph, the 7-day rolling average is almost vertical. In the past week, the Thunder Bay district saw 60 new COVID-19 cases reported in one single day, a new high. And yesterday, the number of active cases was at an all-time high of 389. The entire district, of course, is now in lockdown as part of an attempt to curb the spread of the virus. And vaccine rollout is also ongoing. Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit, and she joins us on the line. Dr. DeMille, good morning.
Good morning, Amy.
So to begin with, just where are we in terms of getting those numbers under control?
So as you've already said, we continue to have, a fairly high number of active cases. And of course, last week in particular, that very concerning steep rise in our overall weekly incident rate. So the number of new cases over the previous 7 days. I think, though, what we've seen is a bit of a stabilization of that weekly incident rate. So if we had kept on the trend that we had been seeing sort of early last week, I would have expected it to go up, even much higher where we're currently. So I guess I'm cautiously optimistic that we might be starting to turn the corner on these numbers. However, it is important not to sort of look at that on a day-by-day basis. You have to look at the overall trend. But hopefully, even in the next few days or by early next week, we might see that stabilization and then hopefully a drop. Certainly with the lockdown that we're in, with the school closures, we're seeing less school cases, obviously, right now. That's very good. So hopefully we'll see something fairly soon.
Yeah. Are there other factors that are contributing to what you feel might be a stabilization?
I think people, hopefully people are really abiding by the rules, the guidance, that we've always put out, that we really need to abide by. Stick to your household members. If you have any symptoms, stay home. Of course, if there's anybody symptomatic in your household, everybody in the household should stay home. If it's COVID, that will reduce the spread. We do know that we've had sort of people get COVID because of social gatherings and such like that, and I'm hoping really that people are not doing that. Are paying attention to what's happening, because all of that will contribute to getting our case numbers down.
Well, you have also recently strengthened enforcement measures around self-isolation, but a local MP would like to see things go even further. So Marcus Pulowski has asked the government to designate COVID-19 as a virulent disease so that medical officers could apply to the court to actually detain people who don't isolate. Would something like that be helpful to you? The issue of people being non-compliant with self-isolation has always been challenging, whether with COVID-19 or other infectious diseases. And, there's a number of ways that public health deals with that, and we've been, dealing with that through the various ways that we have. I think there's a challenge around what Mr. Pulowski is talking about, because that's a section in the Health Protection and Promotion Act that really has always been used for tuberculosis, which is an altogether different illness. And, a longer term of infectiousness, for example. COVID-19 is something where people are only really infectious for about 7, maybe up to 10 days. And by the time you start to prepare that order and apply to the court, and then go before a judge to issue that sort of confinement order, most of the isolation period is already over because of that. And so it becomes very tricky to use that kind of option for COVID-19. So, one of the main measures we are using now is that lockdown, which we've referenced. But there are people in smaller centres raising questions about that. So the mayor of Marathon has asked why they need to be included in the lockdown when they aren't in the same situation as Thunder Bay. What would you say to him? Is there any leeway there?
Yeah, I certainly do understand where Mayor Dumas is coming from.
I think the challenge is the legislation is written and the approach that the province has always taken is that this is at a health unit level. And, here we are in the north. We have geographically the second largest health unit in terms of that geographical size. Mm-hmm. And, and Mayor Dumas makes a very valid point that, a community that's literally, 300, 400 kilometers from Thunder Bay, and that the hot spot is Thunder Bay right now and the surrounding communities, of course, that it does impose restrictions on a community like Marathon or others that are out there that not necessarily warranted by what's happening in their area. And certainly I could say that to the province, but the legislation and the way the framework is applied is those restrictions are applied at a health unit level. I did, though, when we made the decision to suspend in-school in-person learning for schools, that's a measure that I just applied with the school boards here in the Thunder Bay and surrounding communities.
So is this something you have brought up with the province then?
Mentioned it. I think that's brought up before, but I think there has been in the past as well, including even last year when we were reopening, opportunities and that reopening across the province opportunities. But it was, generally always done. They weren't going to go to that level of granularity, as far as I understand.
Mm-hmm. This lockdown is also different because the province is allowing many retail businesses to remain open at limited capacity. And that is leading to some frustration, certainly among the sectors that are not allowed to reopen. So including personal service businesses like salons, like tattoo parlors. What would you say to them, those who say they would like to reopen it and feel they can do it safely?
So again, that's the legislation that framework has outlined what happens across various businesses and retails and other settings during the different phases of the lockdown. And I recognize that that's challenging, and one could it's always a balance, right, of sort of shutting things down or closing or putting on restrictions. And trying to apply that sort of fairly across a variety of different settings and applying sort of the same principles. But there's never a perfect fit in terms of what we do. And sometimes it's not about necessarily the business or the retail outlet themselves. It's about the overall, pushing people to really be compliant with all the regulations. I mean, what puts businesses at risk is not necessarily what they're doing or what they're not doing. It's what people coming into those facilities are doing or not doing.
Mm-hmm. I think it's fair to say, though, that some businesses are feeling like they've been singled out here.
Yeah, I mean, it is challenging. I do agree that their hardships are put on people and and on families, and I hear about those. And it is not a comment about whether they're doing a good job or not. And it is the way it is.
I'd also like to talk about the vaccine rollout, including the fact that some people over the age of 85 began being vaccinated. And I understand that that clinic filled up in a flash. Was it the response you were expecting?
Oh, absolutely. And, we were... we obviously opened up our immunization clinic, our big immunization clinic this week, and that was a target group that we wanted to start reaching. And we know the government has sort of labeled that sort of for mid-March, so we were doing it a bit early. And when we knew that there would be an enthusiastic response, we will be opening up our phone lines again as we plan for the next week and what we're able to do next week. And so we will continue to sort of get people through. And it was very exciting, really, what happened yesterday. Very exciting that happened.
Yeah. And next week, would that be 85 plus again, still that age group?
Yes, I believe that we will continue. We'll work down. The overall provincial plan is to work down through the age groups as we're able, starting, of course, with individuals 80 and over. And I think we were just trying to manage and getting the people, manage the flow and the calls that we were getting, and manage, the individuals. It's age-based. The older you are, the higher risk you are. So that's the approach. And, I'm really looking forward. I do anticipate we will be getting, more vaccine and broadening out the immunization rollout, and looking forward to being able to move forward not only with that older age group of individuals, but all the priority areas more comprehensively in the upcoming weeks.
Mm-hmm. And I know there are a number of vaccine rollout efforts going on across the city, clinics popping up in different locations. Would you be able to give me that bird's eye view of what is happening in the city right now in terms of vaccine, in addition to that clinic we saw open up this week?
Yeah, and we're looking at the city, but also the district, mm-hmm. And so the ramp up. There's sort of, I'm going to say, 4 main areas of focus. The first one is sort of that vulnerable population, the one that's really that outbreak that we've been experiencing is a part of, and we're doing a variety of different small pop-up clinics and clinics with other community partners to try to mitigate any ongoing spread in that population. We also have Indigenous population being one of the priorities for Phase 1 that the government has set out, and that includes urban Indigenous but also First Nations communities. So we've seen one of the First Nation communities outside of Thunder Bay was immunized yesterday. We have another one coming up on Friday. And of course, Matawa Health Cooperative was doing work here in Thunder Bay around the Indigenous their community members that are here in Thunder Bay again, but focusing on those at higher risk. So another group is that older age, so individuals in our case 85 and older, but also reaching out to retirement homes and other congregate settings for seniors. That happened yesterday, and also a senior setting in Marathon in the recent days. And the final group that I'll mention, that is healthcare workers. So healthcare workers remain one of the priority areas, and immunization. The hospital is largely leading the immunization of those highest risk and very high risk healthcare workers.
Mm-hmm. And I know, of course, in order to keep going with this, it all depends on supply. Do you think that the situation in Thunder Bay, the high case numbers here, might lead to us getting more supply? Is that something that you can go to the province with and say, and ask for more or quicker supply?
So certainly myself and I would say the hospital as one of our key partners on this, we have been advocating for supply and our needs, and even a little bit of an expansion of some of the priority areas so we can cover sort of individuals in that vulnerable population that we call it, but I think what we're actually going to see across the province is more access to vaccines. I think the issue of vaccine supply, especially what we experienced at the end of January and February, is clearing up, and the province is very optimistic that we're going to be seeing across the province more supply, and that's what we're anticipating here. We do not have the details at this time, but we're certainly preparing for that.
Well, Dr. DeMille, good to talk to you about that vaccine rollout this morning. Thank you so much for taking the time.
Thank you very much, Amy.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.